Hey, Dr. Pelto here. I had a question from a patient. Many times patients are unsure like what they should expect before they come to the first visit in the office. So I want to go over that a little bit with you, kind of what your experience will be. So let's say you want to go see a podiatrist. And first of all, you're going to make an appointment. In our office, you can make an appointment online or you can call the office, either way. But once you make the appointment, we tend to send patients an email so that they can register online before. This is so you can save time when you come to the office. You can put in your past medical history, kind of what's bothering you, all those types of things. Now, one thing I didn't put in here, in my opinion, I want to explain something to you. My best patients are the patients that after they register online, they go to my YouTube page and they watch some videos on the condition that they have, either going to my website, drpelto.com, or some videos. Like those are the best patients to treat because they've already watched maybe a 30-minute webinar on bunions or on plantar fasciitis or on Achilles tendonitis if they think they know what they have. So this is a point I didn't put in here, but I think it's my favorite patients to work with are the ones that have watched some videos. So if you haven't watch an appropriate video before you go see the doctor. You're going to meet my medical assistant. They're gonna check you in. They're gonna do usually some type of imaging. Usually it starts with X-rays with my medical assistant. If you have a bony problem or something else like that, they'll get the history, and then I'll come in. And I'm usually the one that does the ultrasound if needed. I do many ultrasounds for any type of tendon or plantar fascia or any other types of tendon pains. Once we meet, we kind of get to know each other. I tell you a little about myself, a little about my family. I get to know about you, kind of what your goals are, what's causing you pain, how long it's been hurting you, how it affects your life. That's called the history. And then I'll do a physical exam looking at your foot. I usually do an ultrasound or some additional imaging. Many times I'll watch you walk because if this hurts when you're walking, we can look if you have a low arched foot or a high arched foot or what's going on when I watch you. Then, as I said, like an ultrasound. And then we're going to do something called a plan for treatment. And I specifically use this little thing right here in my pocket, which I carry with me. It's a foot treatment checklist. And I'll fill this out and I'll give you resources on something called Patient Education Genius, where I can send you specific links to learn more. But now, mind you, if you watch these videos before, many times it saves you one appointment visit. And if you try everything to get your foot pain better before you come and see me, it's going to save you a lot of time before seeing me. So you're always almost like on base two, on second base before you come into the office. So we'll make a plan and then we'll kind of reassess and start those types of treatments for you. And many times the benefit of coming in is we can start treatment the same day. It's not like you're going to come in and then you're going to come back another day for evaluate your findings. So, we tend to treat things right then, especially some of these simpler things like ingrown toenails and other things like that. So if you are interested in making an appointment, go to drpelto.com. There's a little link there. You can make an appointment for you in the office. And if you have any other questions, please let me know. But that's what you would expect if you come in to see me or most other podiatrists. Okay, thanks.